So, welcome. Today we are doing a pediatric focused CPR review, and we always do a special monthly topic. So, this month, since it's the end of March, heading into April, we're going to do our spring allergies and asthma, inhalers, and anaphylaxis. So, taking a look at those and how to use them and what they're for. So, this is sponsored by the Save a Life initiative through the Disc Foundation, and I work with the Disc Foundation. I'm a nurse and a medical educator. I live in Maryland. We have a rainy spring day today here. So I hope you're doing well where you are and whatever time zone you're in. The purpose of the Disc Foundation was to save lives. So that's what we do. We teach other people how to do CPR, first aid, and even train trainers so that they can teach other people. And I do have lots of clients all around the world. So I'm glad that you're here and learning a little bit more about CPR. So, of course, why do we do CPR? We are trying to save lives. So, specifically, we're going to talk about pediatrics today, which is children. And if you have ever looked at the survival rates for CPR, they're actually pretty low, even with CPR. So, it's 10% for anyone who had a cardiac arrest outside of the hospital. It's a little higher for people in the hospital, about 20%. So, we are trying to help raise that. And we do know that CPR can double or triple a victim's chance of survival. That most critical time period after someone does collapse is those first few minutes. So that's why we need to act. Can't wait for an ambulance to just show up because sometimes they take a few minutes. So we're losing that really critical time window if we don't choose to act. So people are worried about a few things though when they do CPR or when they come across the decision to do CPR. We do want you to make sure that the scene is always safe. If it's unsafe, of course, you just need to call 911 if you're here in the US. Call your firefighters and wait for assistance. We don't want you to become another victim. If you're afraid of getting a disease, that's of course valid. We don't do mouth to mouth anymore on people unless this would be a loved one and you choose to, you can do that. So, your own child, family member, of course. But if I come across someone in the public, I'm not going to do mouth to mouth. But I do keep a CPR mask in my first aid kit. So, I do recommend that. And we do want you to always wear gloves. And if you have other gear available, the masks and the gowns, of course, do that also because we don't want you to touch bodily fluids. That is how disease is transmitted. So stay clean from that. We are worried about liability, but we do have in the US a Good Samaritan Act that protects anyone who stops to help at the scene of an accident or an injury or a medical problem. If you are working to the best of your ability and following the directions of the 911 operator, you can't be held financially liable for anything that happens. And understanding that people can die anyway, people will be hurt if there's an accident. We can't prevent or treat every single thing that happens. So we're just trying to help stabilize them until they get to the hospital. That's our goal. I do often get the question about hurting someone or breaking a rib, even specifically. But remember, we can't kill them if their heart is not beating and we do nothing, they will be pronounced dead. So, really, it's the reverse. If we do nothing, we are hurting them. So, people would rather, excuse me, um, recover from a broken rib. That does happen when we do chest compressions, than not recover at all. So I want you to just put that out of your mind. You're saying, I don't know what to do. I might hurt them. It's okay. You can even be wrong and they don't need chest compressions. And if you're still doing them, it's fine. You can't hurt them. If you're unsure of your skills, it's great that you're here today to review. Of course, you can take a CPR class in person, an 8-hour class, and really practice your skills. But even when we do that, it's good for 2 years. And if you don't use it, you can kind of forget it. So it's good to practice and have some mock drills at your workplace or school or at home, and make sure everyone knows what to do in different types of emergencies. So this is our pediatric chain of survival. We're going to look at 2 of these steps. The first step, of course, for children is to prevent any cardiac arrest. That is by supervising children, chaperoning, baby proofing, all of those things. Our number one cause of death in children is accident or injury. It's not disease as it is with adults. So technically, you can avoid all of these things if they are accidents. So that's our primary step there. But if something does happen, the very next thing we want you to do is call for help. We pretty much all have cell phones now, so calling for EMS, which is our emergency medical system, and if you need to, performing CPR right away. And that is, if they're not breathing, we're going to do CPR, and you can be following the directions of the operator on the phone so that you don't even have to remember what to do. You can just follow along and do what they say. Those next steps are for our healthcare providers. So we let them deal with that, and that talks about getting them to the hospital and the care they receive in the hospital and after in the hospital. So before we jump into that review, let's look at checking for an emergency with pediatrics. So we have a short video here.
Sometimes it will be obvious that an emergency exists, but other times the signs of an emergency may be less obvious. In order to determine if an emergency exists, you will use all your senses. The first signs of an emergency often include unusual noises, for example, screaming, crashing, or crying. Unusual odors, like a chemical or other noxious smell. Unusual appearances or behaviors, such as a person moaning, staggering, appearing unresponsive, or clutching their throat. Our goal is for each of you to leave this course with the confidence, knowledge, and skills to take action when an emergency occurs. Remember that the risk of infection when giving first aid care is very low. Using personal protective equipment, or PPE, reduces the risk even further. After you recognize that an emergency exists and have decided to act, your role in an emergency may include checking the scene, obtaining consent, and checking the person, calling 911 and getting equipment, and giving care according to your level of training. These steps will all be explained next.
All right, back to our PowerPoint. So CPR, we're going to run through the steps here. It stands for cardiopulmonary resuscitation. And we are quite literally pushing on the heart by pushing on that chest bone up and down. And we are doing the function for the heart and the lungs when it's not able to do it. So you can combine the rescue breathing with the chest compressions. You can do just chest compressions alone if this is a stranger and you don't have a CPR mask or a breathing barrier. There is already oxygen in the blood from the last time they had a breath. So we can circulate that oxygen around. And that's what we're doing. We're pushing on the heart. The heart pushes the blood out to the arms and legs and to the head. We don't really care about the extremities during this moment in time, but we want to get oxygen to the brain, and then it kind of all circulates back. So one pulse is every time we push down, we're pushing blood the whole way up and back. So just kind of keep that in your head. You're actually doing the pulse for the person. We're beating their heart for them. Now, in children, they are more likely to have respiratory problems, and then the breathing will stop, and then the heart will stop because it doesn't have enough oxygen. The reverse is true for adults. The older we get, the more likely we are to have a cardiac problem first, like a heart attack. That's the most common. And then that will stop our breathing. So that's why with children, we focus on the respiratory problem first, if we know what it is. Now, children can have cardiac, congenital disorders, heart problems, things like that. So if there's something you know about and it's a heart problem, that's of course like, can happen. But generally speaking, respiratory problems, which we would count the asthma, anaphylaxis, not breathing, choking, and drowning. Those are the top ones. And then some of the other ones can be respiratory illnesses, influenza, which is the flu, the COVID-19, lots of pediatric respiratory illnesses, and viruses and things like that that will cause breathing problems. So, what we are going to do is the same steps for infant, children, and adults. Adults starts around adolescents or teenagers, kind of if someone is middle school age, hitting puberty, 13, maybe 100 pounds, they can be counted into the adult steps for CPR. And children, we do from 1 year old to teenager. So, infants are 0 to 12 months. For all these categories, we're checking first, looking around, making sure the scene is safe. So if we see someone fell, we can go assist them. If we're hiking and we don't know why they fell, you need to, look and see, was there a snake bite? Did they trip? Is there something that can be dangerous to you before just running in and helping? For everyone, we're checking for responsiveness. On children, we're tapping and shouting on the shoulders, "Hey, are you okay?" Then we're checking to see if they're breathing normally. Now, number two is a decision point. So if we see some sort of response, they're responsive. So if they're moving or mumbling or talking or open their eyes, that means they're responsive. So they should be breathing. Maybe they just fainted. Something's going on. So we can still call for help and stay with them, but we don't need to do CPR. But if we're tapping and shouting and get no response, they're only moving from us moving them, then we're next going on to see if they're breathing. And we're just looking at them. We've all looked at children when they're sleeping to kind of see, are they breathing, especially smaller kids. And we can look for their chest to rise, movement in their mouth, feel air, a couple different ways you can do that. So we're just looking at them for about 5 seconds to see if they're breathing normally. If you're not sure, you're like, you don't think you're seeing breathing, that counts as not breathing. We have to trust ourselves. People breathe, 12 to 20 times a minute, which is every 2 3 seconds. So, um, doing it for 5 seconds, you should see a normal breath. They shouldn't be gasping or making a loud noise or straining or things like that. So anything that's abnormal counts as not breathing normally, and you can start CPR. Especially if we're talking about the asthma and anaphylaxis, if someone is gasping for breath, like choking or their throat is swelling, we might need to assist that person and do CPR, even though they're getting a little air. So we start with the compressions. The rate is 30 and 2 if you're doing the rescue breaths. If you're not doing rescue breaths, you can just do chest compressions. You don't have to count. If someone can time it, we do check every 2 minutes. We'll switch providers, which is the person who's doing chest compressions. And that's also when we check for the breathing again every 2 minutes, kind of just assess the situation again to see if it's the same or different. You see the different numbers on here. You can go to 15 and 2, which speeds up the rescue breaths, you'll have more rescue breaths per minute. You'll have the same amount of chest compressions. Only if you have two providers who are comfortable with that, they have practiced before, they know what they're doing because it involves some switching. If you're not doing the rescue breaths, ignore that. If someone can bring an AED, you are welcome to use them. It's not a necessity like it is for adults because the child is most likely having a respiratory problem and maybe the heart is still beating, but you can turn them on when you get one if someone brings it to you and put the pads on their chest. They're very easy to use. You just follow the pictures that are on the screen or on the pads. When you look at number 4 and number 8, I just have to mention that rule because it's in our CPR steps. It's not very likely to happen. It's saying if you don't have a cell phone or a phone that's working right that second, like you are by yourself in the woods with a child taking a hike, or the phone doesn't have reception where you are, the battery died. I mean, there's lots of reasons, but we're hoping that people have access to calling wherever they are. So if you don't have access to call 911 or call your emergency medical services, what we're saying is go through this scenario and do CPR for 2 minutes before you leave the scene. That's what that's saying. So if you can put your phone on speakerphone, even if you're by yourself or if somebody else is with you, they can call. They're going to be doing the calling up in steps 2, 3, and 4. It can be happening simultaneously. Um, if we can't call for help, we need to do CPR for 2 minutes because of that fact that children are more likely to have a respiratory problem. So if we can give them assistance first before any time lapse without assistance, it's more likely that they will be able to resuscitate. The opposite is true for adults. Um, if we come across an adult who's not breathing and we don't have a phone, it's better to run and get for help immediately because they're more likely to have a heart problem, which can't be fixed out in the field. That's something that needs a hospital, a cardiac cath lab, things like that. So when we look at some differences for infants, you'll see it didn't change that much. We're still checking to see if the scene is safe. I will show you in the video. We don't tap and shout on infants. We flick the bottom of their foot like this. So you do have to take off their socks or their onesie. They're just kind of too squishy up at the top to really get their attention that way. Um, the rest is the same. So you'll see the differences for infant are just the positioning of your fingers doing chest compressions and how we tap on the foot. And for adults, that's our main set of steps. They go make sure the scene is safe. Hey, are you okay? Calling 911, sending someone to get an AED, assuming you have other people helping. Check to see if they're breathing. If they're not responsive and not breathing, we're starting chest compression. So it's really only those 5 things that you want to remember, and then we're applying them to the children and the infants. So let's take a look at the differences here on the video.
You can save a life when the heart has stopped beating. When you give CPR, you keep blood flowing to the brain and vital organs. High quality CPR can double or triple a person's chance of survival if it is provided in the first few minutes of a person experiencing cardiac arrest. Knowing how to perform high quality CPR ensures you are doing everything you can to save a person's life. To provide high quality CPR, use correct hand placement and body position. Compress the chest at a rate of 100 to 120 compressions per minute. Compress the chest to a depth of about 2 inches for children and about 1.5 inches for infants. Allow the chest to return to its normal position between each compression. Do not interrupt chest compressions unless it is necessary to do so. For example, to give breaths, apply the AED pads, or move the person because the situation becomes dangerous. In those cases, minimize interruptions to chest compressions to less than 10 seconds. Avoid excessive breaths. Each breath should last about 1 second and cause the chest to begin to rise.
Oh no, someone's collapsed. Scene is safe. It appears unresponsive. I don't see any life-threatening bleeding. Little boy, are you all right? Are you okay? He's unresponsive and not breathing. Call 911, get the AED and the first aid kit.
I'll call 911 and get the AED and first aid kit.
And 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3.
Here's the AED and first aid kit. EMS is on the way. I'll go wait for them.
Attach pads firmly to person's bare chest as shown. Plug-in connector. Don't touch person. Analyzing.
Clear.
Shock advised. Press flashing shock button.
Clear.
Shock delivered. Start CPR.
4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, and 2, and 3, and 4, and 5, and 6.
And we'll look at the one for infants, and then I can point out these differences also.
No, there's something wrong with Priya.
Scene is safe. I'm Joanne. I'm trained in first aid. I can help.
Okay.
She appears unresponsive. Can I take her?
Yes.
Priya, are you okay? Priya! She's unresponsive and she's not breathing. Call 911, get an AED and a first aid kit.
I'll call 911 and get an AED and a first aid kit.
4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, and 3, and 4, and 5, and 6, and 7, and 8.
Here's the AED and the first aid kit. I'm on with 911.
Attach pads firmly to person's bare chest as shown. Plug-in connector. Don't touch person. Analyzing.
Clear.
Shock advised. Press flashing shock button.
Clear.
Shock delivered.
1,
Start
2,
CPR.
3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7.
All right, so let's take a look just at the differences with the infants. CPR infants. Here we go. And I just want to show you a few things on here. So we talked about the
On the center of the infant's chest, just below the nipple line. Then use the other fingers to encircle the infant's chest toward the back, providing support. You are now in the correct position to give compressions.
So we can do this sandwich type of compressions where you're putting your hands around the back and these thumbs, kind of this way on the front, like she just showed here, just like that. You can also do 2 or 3 fingers, and it just kind of depends when you look at your fingers. Like my index finger is shorter, so I would use these 2 fingers. So it's whatever makes kind of a flat line you would do. You can also do straight down on your infant, and let's see if they show. How to say, are you okay?
Compressions to an infant as a single responder. Use the No Soft mattress. You can perform CPR there, but if there's a thick, soft mattress, it is better to move the infant. Steps for giving chest compressions to an infant is the same as for adults and children, but the technique is different because of the infant's smaller size. First, ensure that the infant is on their back on a firm, flat surface, such as the ground or a stable tabletop.
Okay, so those are really the differences. And then let's go back to the PowerPoint. We can finish up. All right, so if you take a look, just to review with children, is the scene safe? Hey, are you okay? Check to see if they're breathing. Call for help if you can. Start chest compressions. The rate is 30 and 2. If you're doing the rescue breaths, if you have a second person, you can go faster and do 15 and 2. So that's just so that one person is doing compressions and one person is doing breaths. If you're doing it by yourself, you have to physically move your body, if it's a child. For infants, same thing. We're just going to tap the bottom of their foot, and you have different hand positions for the compressions. All right, so they did mention a few of these things. The rate is the same for everyone, 100 to 120. It's pretty fast. We think of that Staying Alive song. If you know that one, Staying Alive, Staying Alive. It's pretty fast. You want to think of heartbeat and think faster than that, because our hearts don't go normally as fast as 100, but we're trying to do more because it's not as effective. If you are doing rescue breaths, you want to try to open the airway. We saw some of these. The head tilt chin lift is just pushing and lifting. A jaw thrust is just trying to open the jaw without moving the back of the neck. That's if we suspect a head, neck, or spinal injury. If you do have a breathing mask, you want to have a tight seal, and we're only trying 2 breaths. If the chest doesn't rise, that means the air is not going in the lungs. You should be able to see it rising up. So we can reposition for that second breath, which just means turn the head again, make sure your mask is on correctly, hold the seal down well. But if we don't get it the second time, that means it's just not going to work. You could have obstruction, choking, swelling, you know, positioning could be wrong. So we're just going to skip it and go back to chest compressions. Chest compressions is the most important thing to do. So again, you can choose to do rescue breaths or not. And if you're trying them and it's not working, don't get upset about it. Just continue with the chest compressions. So when we talk about the respiratory problems, the choking is in there. That is a common problem for children and infants, of course. So we're going to try to keep small items and small pieces of food from them. But of course, we know that children can find things you don't even know that are there, you know. The best thing to do is to encourage coughing. So if you hear coughing, the body is trying to get that out itself. So we encourage it by just staying with them, being encouraging, you know, and being in a good position, you know, upright, kind of leaning forward, that kind of thing. Just making sure the body can help itself. If you get to the point where there is no more sound, so we're coughing, and then they go. So we're still trying to cough, but now no sound is going. That means the vocal cords have been completely obstructed and we no longer have any air coming through. So that's the good news, is that if we hear coughing, there is still air getting through. Okay. If someone does pass out, and this is children or adults or infants, from the coughing because they're not getting enough air, you're going to put them on the ground and start CPR. If we get to the sound disappearing, that's when we can intervene with the abdominal thrusts. And a lot of people know how to do this, where you put a fist, put your hand around your fist. So I'm around a person. And if they're a child, I can kneel behind them. The person can be in a chair and I can squat down behind them. It's just we are both upright still and they're still conscious because they're upright. And I'm just pushing in and up. Okay. So I can do that for children and adults. For infants is different. If we can hold them in our lap comfortably, so they're less than 12 months, then I can flip them back and forth, keeping that head lower down, letting some gravity help with the stomach, pushing these whatever's in them out. So we can kind of take a look at this.
If an infant is conscious but choking, deliver 5 chest thrusts using the 2-finger technique, resting the infant against your forearm and thigh. Turn the infant over and deliver 5 back slaps. Continue alternating 5 chest thrusts and 5 back slaps until the airway obstruction has been removed. Make sure to support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes unconscious at any time, begin CPR.
All right, I want to show you that the
Support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes
this position right here, and we're saying chest thrust is not an abdominal thrust. So we do abdominal thrusts for children and adults, which is lower. It's in the stomach, it's in the squishy part. Infants, we are doing chest, which is the chest bone, the breastbone, the sternum. excuse me, and it's the same as the CPR. So I'm doing those same couple fingers. I'm basically doing CPR. I'm just having their head lower to try to help get that item out if I can. But if they would go unconscious, then, I'm already doing CPR. And let's take a look at, there we go. So the review, we have looked at each of these. We talked about the 30 and 2 is the regular rate that you want to memorize. Compression should be 100 to 120 a minute. You can choose to do rescue breaths if you have a breathing barrier or a CPR mask. If you have an AED available, definitely have someone bring it. The first thing you do is turn it on. There's always a big green power button, and then follow the directions. It will talk. There'll be pictures. You can just follow along. And we just looked at the choking. So I mentioned we have this leading cause of injury in children from 1 to teenager is the accident or injury, leading cause of death, excuse me. So adults, are different things. And we've talked about each of these before in different webinars. So today we're going to look at asthma attack, inhalers, anaphylaxis, and EpiPen. So if someone's not breathing, a child, shortness of breath, trouble breathing, labored breathing, unable to talk, stopping to breathe in between words. So that's like saying, you say, hey, are you doing okay? What's going on? And they might be like, I can't breathe well. So they're kind of taking breaths to get words out. Fast, slow, gasping, wheezing, high pitched noises, changes in the skin color. They could be red or blue, white, pale, dizziness. There is a chest tightness with an asthma attack. And generally, kids are too young to have a heart attack. So that's more what we think of as the breathing if a child says that. So let's take a look. We have a little video about this.
A person with asthma should be able to let you know if they're having an asthma attack. Signs and symptoms of an asthma attack include wheezing or coughing, rapid, shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, and sweating. For a person who is experiencing an asthma attack, quick relief medication, such as albuterol, can help quickly open their airways and allow easier air passage. This medication is delivered via an inhaler. You may assist with administering this medication. Follow the general care steps for assisting with medication administration. Then, shake the inhaler, remove the mouthpiece cover, and attach a spacing device if necessary. Give the device to them and encourage them to use it as directed by their healthcare provider. Finally, be aware that more than one dose of medication may be needed to stop the asthma attack. The medication may be repeated after 10 to 15 minutes.
And we will look at anaphylaxis.
Anaphylaxis is a life-threatening allergic reaction that can cause shock and affect the person's ability to breathe. Signs and symptoms of anaphylaxis include history of an allergy, signs of an allergic reaction, swelling of the face, neck, tongue, or lips, trouble breathing, shock, and a change in responsiveness. Epinephrine can help slow or stop the effects of anaphylaxis. People known to have an allergy may carry an epinephrine autoinjector. There are several different epinephrine autoinjectors on the market. You may assist the person or family member with this medication. Follow the general care steps for assisting with medication administration. Then, give them the epinephrine autoinjector. Hold the person's leg firmly to limit movement. Encourage them to use the epinephrine autoinjector as directed by their healthcare provider. And finally, massage or have the person massage the injection area for 10 seconds. If the person is still having signs and symptoms 5 to 10 minutes after administering the first dose and EMS has not arrived, help the person to administer a second dose.
All right, I want to show you these. Inhaler, don't be afraid to pull it out. This is just a plastic container. And so the medication is really in this metal vial and it's pushing this button that causes it to come out. So sometimes you can see, I don't know if you can see that on the camera, a little bit of aerolized powder. They do have expiration dates, so I do pull them out to look at the expiration date on here. This one's March 24. Some of them have counters on them, like this is 160, I think. So there's usually 200. So there's like little teeny numbers in there. And so with inhalers, we often shake it for 5 to 10 seconds because it's sort of a powder aerolized solution in there, liquid, and then do it. And sometimes you have to hit that one dose out in the air. Don't breathe it in yourself to get it going. If it's been sitting a while, if you use it fairly often, you don't really have to do that. We call that priming it. And then with the EpiPen, let's see. One. These are how mine come, and they have little caps. So you take it out, you take one out. There are two in here, like they mentioned. They're just clamped together, and it does say the orange is, it says needle end, and orange is supposed to be more danger, like red. And there's also a place on it to check to see if it still looks good. And it does give you the directions on here too, if you haven't done it before. So there's adult doses, there's pediatric doses. So those are like different colors, different sizes. Some of the EpiPens are little square rectangle cartridges now, not these long ones. So they can come in different shapes and sizes. If you are watching a child that has inhalers and EpiPens, you need to review their paperwork ahead of time. Even if you're at a place where it's a drop-in and they're only there for an hour or two, you need to look at these. You need to be familiar with them. We do also have EpiPen trainers, and I use those in my first aid classes when I'm in person. And so they look exactly like this, but they don't have the needle in them. They're practice ones, but you can actually practice shoving it. If I did this, the needle would come out, so I can't do it. But this one has the medicine in it, and they look the same, but the ones that say trainer have the big word trainer on the side, so you can't mistake it. The needle does come out and back in, so you can just lay this on a table afterwards, and then you're supposed to put it in a sharps container if you have one. But generally speaking, if we do an EpiPen, we are sending this child to the ambulance, so you can send it with them if you need to do that. And so signs of anaphylaxis is just trouble breathing is what it comes down to. And it can be coughing, not being able to catch your breath, not being able to speak, or if we get any of the hives on the face, like other things on the face start swelling, eyes, nose, mouth, we have to assume that the airway could be swelling on the inside. So we'll do it anyway. Um, what else can I tell you about them? If we have hives on the body and not on the face, which can happen, you can do a wait and see. You can do like Benadryl or other antihistamines. Often there's like an action plan for asthma where the doctor will list, do this for this symptom, this for this, but any trouble breathing, which is that list, the coughing, not speaking, changing colors, swelling, we're going to do the EpiPen. All right, let me show you our website. And you have your own code to do our courses for free here. So you're going to go to savealife.com, and I am going to put the direct link here in the group chat, which is nhcps.com, which is our National Healthcare Provider Solutions. They're hosting our website, but you can go to savealife.com. So let me put that in there also, savealife.com. And to get the free course, all you need is an email address to sign in. You don't have to put any credit cards in or anything like that. So just an email address, make an account, take CPR. I'm putting the free code in here, which is helper CPR. So helper without the E, CPR, just all together. That's what you're going to use. And this works if you are a provider for helper, they can count this, or if you are a parent, want this for yourself. So you go through the course, it's all online. You do that on your own time, take the test. Once you pass the test, you can instantly download and print a provider card and also a certificate if you like the full page certificate. We have other courses for healthcare providers on here also, but let me just show you. If you put CPR in your cart, it's normally $59, but then when you put the code in for the coupon code spot, it'll say $0. So you can see right here, it says coupon code right underneath the product. So that's where you can go ahead and put that in, and it'll get rid of the cost for you. Also check out our free resources here at the top. We have just different ways to study, and then we have a mobile app, which is free on the App Store. It's called Medicode, and CPR is on that. So you can check that out and you can practice and look things up when you're on the fly. And we also have handbooks, so you can download a full color 50-page CPR handbook, keep it on your computer, print it out. We also have some other languages that we have translated that into. So make sure you write down or copy the link and the free code so you can use that when you have time. And I am happy to answer any questions that you have now about pediatric CPR or asthma and anaphylaxis. And if not, I want to thank you very much for attending today. You are quite welcome. Well, thank you for coming.